began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree, unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
We have known about CAPS-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic.
So the policy crisis in question for this board in this meeting is this: how should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most?
What we've seen work very well in the HIV field is, in fact, procurement through the Global Fund. So having a centralized mechanism, so financially able to procure on behalf of affected countries would be critical. I think the second thing is it's going to be very important that for the business sector, for manufacturers of antivirals, that we have clarity around what the need is and where the need is and who are making the decisions.
I think that given that the countries most affected are those that are low and middle income countries with unequal access to technology, to finances, the UN has a worldwide footprint, universally recognized, and universal membership.
A global stockpile would certainly help ensure more rational and strategic allocation, but the reality is that we don't have the logistics capability, even within the UN, to bring that together in one place and run it. So this is where I think a collaboration between the international organizations like the World Health Organization and the private sector, which runs these supply chains for many purposes every day, understand where the supplies are, make smart decisions about how to allocate them to the people who need them in the places that need them the most, and then work with the industry to move those supplies from where they are today to where they need to be.
Just to underscore the point that cooperation among supply chain providers or businesses that have huge supply chains can add a lot of efficiency to the whole process.
The question is, can you, through this international mechanism, really promote commitments to doing this as quickly as possible and give people a sense that actually if they contribute more, that they will have a better chance of protecting their own populations and their country's security and health.
So to be completely clear, most of this production would already be committed in contracts.
Yes.
It is almost unheard of that people are producing product without having a forward commitment for the consumption of that product. So the first thing that needs to be done, because this is not something that the countries currently control, unless countries are going to bring about emergency situations and co-opt an existing supply chain.
I think it's not likely, I agree, that countries are not going to buy countermeasure to put into a global supply without retaining a large portion of it for themselves.
Public health agencies have issued travel advisories, while some countries have banned travel from the worst affected areas. As a result, the travel sector is taking a huge hit. Travel bookings are down 45%, and many flights have been canceled. A ripple effect is racing through the service sector. Governments that rely on travel and tourism as a large part of their economies are being hit particularly hard.
How should national leaders, businesses, and international organizations balance the risk of worsening disease that would be caused by the continued movement of people around the world against the risks of profound economic consequence of travel and trade bans?
If there's some sense that there's a UN institution that can do all of this, then I worry we're suffering from a delusional disorder on the power of the UN. It's really important to get those industries and their trade associations and an efficient leadership established, which is decentralized, but has a collective responsibility and accountability. And that needs to be supported by the public leadership.
What is essential, what is non-essential travel, we have to clarify this. Otherwise, if we go down to 20% bookings over a long period, the company will run down. That's a fact.
You know, there's a whole complex set of issues in a highly interdependent world on supply chains that are just in time. We need to think about how much flex there is in that just-in-time supply chain system and make sure it keeps running. I think it's going to take specificity, and it's going to take knowledge that only the private sector has. The UN can play an important coordinating facilitation role, but the companies know where those commodities are, where they move, how to move them, and that's where a type of public-private collaboration that we have not generally had in these crises needs to be put together pretty quickly.
We are not out of money yet, but the fact is we are trending in a dangerous direction and something needs to change.
So the policy question for this board now is, how should financial resources be prioritized? Are there nodes that we cannot allow to fail? What is your sense of priorities? We don't have money to pay for all of these urgent problems.
So at the moment, we want the funds, right? You need the money. So where's the money? So government kind of supplies some money. A lot of, private sectors, some are sitting here, you have some money. But now you need a really coordinated, centralized efforts.
Hotels will be experiencing, crippling losses doing that. And we know that the hotel business in itself makes up 5% of the GDP.
Governments need to be willing to do things that are out of their historical perspective, or for the most part, it's really a war footing that we need to be on.
We shouldn't underestimate the power of entrepreneurship. We need to escalate that, whether it's through the government's helping with tax breaks or subsidies of that nature to increase manufacturing of those types of products. It can happen quickly. A Marshall-type plan, don't mean to say that exactly, but a Marshall plan that can go into effect can stimulate change very quickly.
Countries are reacting in different ways as to how best to manage the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
How much control of information should there be, and by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments?
I think it's very important that we make sure that there is concise communication with all healthcare facilities where these patients are being treated so that there isn't mass panic.
We're at a moment where the social media platforms have to step forward and recognize the moment to assert that they're a technology platform and not a broadcaster is over. They, in fact, have to be a participant in broadcasting accurate information and partnering with the scientific and health communities to counterweight, if not flood the zone of accurate information, because to put the genie back in the bottle of the misinformation and disinformation is nigh impossible.
One thing we haven't spoken about, and I'm wondering whether it's time to talk about this, is a step up from the part of the governments on enforcement actions against fake news.
I personally do not believe that trying to shut things down in terms of information is either practical or desirable. And we do have, I think, a couple of strategies that are available to us, one of which is the flood strategy, second of which is relying and informing and equipping trusted sources of information with the facts so they can then pass that on. But we also need to actually think about a technological answer to this.
The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad? Are there things we could have done in the 5 to 10 years leading up to the pandemic that would have lessened the catastrophic consequences? We believe the answer is yes. So, are we as a global community now finally ready to do the hard work needed to prepare for the next pandemic?
In this scenario, Tom Inglesby, the director of the Johns Hopkins Center for Health Security, will be chairing the board and serving as the moderator for its discussions. Today's exercise will simulate 4 meetings of the Pandemic Emergency Board, and each meeting will be devoted to one key topic. Each meeting will start with a video and a briefing that will provide the information needed for the board members to engage. The Event 201 scenario is fictional, but it's based on public health principles, epidemiologic modeling, and assessment of past outbreaks. In other words, we've created a pandemic that could realistically occur. And for those interested in our assumptions, we will have a lot of the background research of the scenario publicly available on our Event 201 website at the conclusion of the exercise. The policy discussions, the challenges to be discussed in this exercise represent controversial, high-stakes issues that would require high-level input from business and government leaders.
But there's every reason for us to work together to address these challenges. For one, it turns out that at $570 billion annualized, the annualized risk posed by pandemics is on par and rivals with climate change, which means that the pandemic risk to lives and livelihoods is at a level that governments and the world's biggest businesses can no longer afford to ignore. And we are counting on this conversation today to inform our work together to improve our collective preparedness and to protect lives and livelihoods from pandemics. And to provide further context, I'm very pleased to introduce a short video now from Dr. Mike Ryan, the Executive Director at WHO and the head of WHO's emergency program. So with that, we'll turn to a video.
Unfortunately, I was not able to join you today. I'm involved in the IHR Emergency Committee for Ebola, but I had hoped to be in the room with you because the issues you will be dealing with over the next hours may be tabletop exercises today, but they address real and critical threats which we at WHO take very seriously. Without a question, epidemic risk has become a global strategic concern. I don't think we've ever been in a situation where we have had to respond to so many health emergencies at once. This is a new normal. I don't expect the frequency of these epidemics to reduce, and in fact, vulnerabilities all over the world, developed and developing countries, have increased, not decreased, driven by many, many factors, mainly through human behavior, economic development, population density, and many others. The scenario you will be presented with this morning could easily become one shared reality one day. I fully expect that we will be confronted by a fast-moving, highly lethal pandemic of a respiratory pathogen. The question is, are we prepared to globally respond to the next major pandemic event? Are we ready to cooperate and perform across countries and across sectors to face such a threat? Have we established the surveillance and risk assessment systems, the communication tools, the supply chains, and the business continuity plans that will be needed not only to protect health in a major epidemic or pandemic, but to protect economic development, to protect political and social systems? Do we collectively drive innovation enough to face the evolving global threats which we are anticipating? The nature of pandemics is that many countries will be affected at the same time. This is particularly true with the respiratory pathogen, as they are often transmitted by asymptomatic persons. They spread fast. In 2009, the pandemic virus reached all continents in less than 9 weeks. WHO's priorities are to establish a minimum capacity to detect and respond in each country around the world, to develop global strategies for the containment and control of individual disease threats, and develop global mechanisms to ensure cross-sectoral and multinational, multilateral coordination. Innovation and partnership across all sectors are needed, including joint strategies between global health leaders and the drivers of travel, communication, data technology industries.
At first, the spread was limited to those with close contacts, healthcare personnel, co-workers, and families. But now it's spreading rapidly throughout local communities. International travel has turned local epidemics into a pandemic spanning the globe. Just 3 months ago, CAPS started in South America, but has now reached several countries with more than 30,000 cases and nearly 2,000 deaths.
Good morning, and thank you all for being part of this Pandemic Emergency Board. We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
Continuing our coverage of the newly discovered CAPS disease and the scope of its deadly outbreaks, there are now more than 30,000 reported cases. Experts warn this may be just the beginning of a global problem. GNN science reporters have produced a video about what we know so far about CAPS, the virus, the outbreak, and the resulting chaos.
CAPS is a novel coronavirus related to those viruses that caused the frightening SARS epidemic in 2003 and the deadly MERS outbreaks in recent years. Scientists think each infected person in turn infects on average 2 more people. This disease is proving more transmissible than SARS or MERS and about as contagious as influenza. Essentially, the cumulative number of cases is doubling every week. At this rate, we can expect to see 16 times as many cases in a month unless we find a way to interrupt transmission. The virus appears to be spreading rapidly in densely populated and impoverished neighborhoods in some megacities in South America. CAPS is a serious respiratory disease. More than half of the recognized cases have required hospital care, creating a huge strain on healthcare systems. The fatality rate is about 10%. For comparison, CAPS is about as lethal as SARS and 2 to 4 times more lethal than the 1918 influenza pandemic, the worst pandemic on record. Even so, some people only exhibit mild flu-like symptoms, not requiring treatment in a hospital. Alarmingly, those people are able to walk around and spread the virus, not realizing they are doing so. Even worse, international travelers have been arriving at their destinations symptom-free, but within a matter of hours, becoming ill. Travel-related cases have blossomed into outbreaks in a number of locations and have quickly grown faster than health authorities could respond and contain them. In other places, physicians have quickly recognized the symptoms of CAPS and have been able to isolate infected individuals and avoid an outbreak, for now. Global public health experts are very concerned about this disease because it appears the virus is readily transmitted through the air from person to person. Essentially, all people are susceptible. experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere. Models developed by leading public health authorities indicate a CAPS pandemic could lead to an outcome worse than the 1918 influenza, which killed 50 to 100 million people worldwide. Given the global population is 4 times larger than it was in 1918, if these models prove accurate, we could be looking at hundreds of millions of deaths over the next year or two.
Okay, now we're going to get a briefing on the numbers and distribution of cases by Dr. Caitlin Rivers.
As you've just heard, the outbreak is very worrisome. The vast majority of cases are occurring in Brazil and other South American countries. However, as you can see on the screen, there have been some spread to Portugal, the continental United States, and mainland China. Our models project that with continued spread in Latin America and predicted spread to additional countries, we could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases. We are also tracking financial markets as an indicator of the economic impacts of CAPS. While markets are down worldwide in the past couple of weeks, they are still positive for the year.
Thank you, Dr. Rivers. The first emerging policy crisis for which we need this board's recommendations regards global allocation and distribution of medical countermeasures. And by medical countermeasures, we mean vaccines, drugs, and diagnostics and other medical supplies to help us combat the CAPS pandemic. I know we would all agree that if we had a vaccine in hand for CAPS, it'd be a game changer. But leading vaccine experts say a vaccine in the near term is highly unlikely. But there is an antiviral that does look like it will work. And to understand that better, we're going to watch one more clip here.
Continuing our CAPS disease coverage and possible solutions, I'm joined by immunologist Dr. Yvonne Bello and Dr. Rhea Blakey, an epidemiologist, both highly respected in their fields. Let's get right to it. Why are people saying a vaccine for the CAPS virus is not likely in the near term?
Researchers are working on a vaccine, and we have viable leads, but it's complicated. We have known about CAPS-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic. Even if we discover a good vaccine candidate, we're starting from scratch, and it takes time to test safety and efficacy, typically years. So even if testing moves quickly, global manufacturing will still need to be established. Again, multiple hurdles.
We simply cannot rely on these old timelines and processes. This is a crisis. We have to move beyond these issues. It may be complicated, difficult, but if we dedicate all available resources, this can happen. Also, keep in mind, we need effective treatments sooner rather than later. Extranavir is an antiviral drug. Scientists have told me this could be effective. We need to start treating people immediately.
While I agree Extranavir does look promising, it's currently used for treating HIV. However, it's not manufactured on the scale needed for treating this many people. And will we just stop using it for HIV treatment? How will we get this drug in the quantities needed? Who decides who has priority for the limited amounts we do have? We both know countries are hoarding Extranavir.
Doctor, in my opinion, you are lost in the details. With enough money and political will, anything is possible. Let's get going on this now.
Thank you both for this extremely important discussion. Our U.S. affiliate has just released polling results on public expectations for a vaccine. A majority of Americans expect a vaccine to be available within 2 months, and 65% of those polled are eager to take the vaccine, even if it's experimental. In related news, a significant demand for personal protective equipment like N95 masks and gloves are on the rise due to the pandemic. However, globally, hospitals are running low. Additionally, other critical medical supplies such as saline and antibiotics are dwindling. Countries and companies are reportedly stockpiling supplies, disrupting healthcare supply chains, causing dangerous shortages in many parts of the world.
And finally, for the latest information on what we know about vaccines and this antiviral, here's medical countermeasure expert Matt Watson.
As we've just heard, there is no existing vaccine that appears effective against the newly discovered CAPS virus. Governments, scientists, and companies around the world have become working intensively to develop one, but it's highly unlikely that a vaccine could be developed, tested, manufactured, and distributed in less than a year, and it's likely to take much longer. While there have been efforts to develop vaccines against SARS and MERS coronaviruses, none have been licensed. And given the distinctions in the CAPS virus, vaccines against those diseases would not be effective for CAPS. The antiviral drug Extranavir has demonstrated some efficacy against the CAPS virus. It reduces the severity of illness and saves lives in those who are infected, but does not prevent infection like a vaccine would. Extranavir is a generic drug primarily used to treat HIV. It is manufactured in 5 countries, including the United States and China. Approximately 1 million people take Extranavir every day for HIV. If all of those HIV patients could be switched to other antiretroviral drugs, we could potentially free up enough Extranavir to treat 26 million CAPS patients. Assuming further that we could double production over the course of a year by bringing additional manufacturing online, we could eventually have 52 million treatment courses per year, but it will take many months to get there. And there is not likely ever to be enough to keep up with the need as long as the disease continues to spread at this accelerating rate. Experts agree that while many lives will be saved by this antiviral, it is not going to slow the pandemic in the same way a vaccine could if we had one available. However, we do have the potential capacity to save many people. Now the question is, how do we distribute the supplies we have? Existing global supply chains and logistics networks for Extranavir run efficiently under normal conditions, but the pandemic is likely to be very different. We are hearing that one country where Extranavir is produced is planning to block some or all of the export of this medicine to hold on to it for their own people. Tensions are rising between governments and pharmaceutical and medical supply companies about how supplies should be allocated and who gets to make those decisions. International humanitarian organizations are raising serious concerns about access to antivirals for people in low and middle-income countries. In addition to antivirals, other medical supplies are not reaching those who need them in many parts of the world. This is especially pronounced in low and middle-income countries, which are reporting the highest rates of disease transmission and mortality. In part, this is due to last-minute stockpiling and hoarding by customers, and in part, it is due to cost and logistics issues. Personal protective equipment, such as N95 respirators, are in critically short supply in some areas. N95 respirators are manufactured by many companies around the world, but there are no reliable estimates of how many are produced or what global production surge capacity is. All we can say is that production capacity covers normal demand, and it is not uncommon to have temporary shortages during severe flu seasons. In a severe pandemic, we can expect the need to increase by a factor of at least 2 to 3. Given these supply issues, there are a number of potential proposals being floated aimed at coordinating and facilitating medical countermeasure allocation and delivery around the world. Politicians, business leaders, scientists, and policymakers are weighing in. Some are suggesting that suppliers and buyers continue to work independently to decide where to send antivirals and medical supplies. Others are suggesting that countries where these products are made should be able to decide where those drugs and supplies go. Still others are recommending that suppliers, buyers, and countries entrust a central international entity or organization with the job of allocation and distribution decisions for at least a portion of antivirals and other medical supplies.
Thank you, Mr. Watson. So the policy crisis in question for this board in this meeting is this: how should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most. We now have time for discussion about this matter. This is the focus of this meeting.
The scenario now advances 3 weeks to November 7th, 2019, to the second meeting of the Pandemic Emergency Board.
Thank you all for reconvening on short notice. Let's get an update on the pandemic.
Very short notice.
Thanks,
Dr.
Tom.
Rivers.
In the last 3 weeks, we've seen a significant escalation of the pandemic. Previous projections appear to have been accurate. We've gone from about 35,000 cases to more than 260,000 estimated cases, with 13,000 deaths. This may be an underestimate. We know that there is a good deal of underreporting due to lack of surveillance in many parts of the world. The greatest number of reported cases are still in South America, where the pandemic started, but the number of countries affected has risen from 8 to 23 across the Americas, Africa, the Middle East, Europe, and Asia. We expect the spread will continue to accelerate as we have more outbreaks. We project that in 1 month, we could see upwards of 2 million cases and over 100,000 deaths. And in 3 months, there could be as many as 20 million cases and 1.6 million deaths. The markets are reacting negatively to these projections, with some markets now in the red for the year.
Thank you, Dr. Rivers. All right, we want to show you the latest news on the impacts of the pandemic on trade and travel, which will be the focus of this discussion.
In addition to global public health crisis, CAPS is creating havoc with the trade and travel industries. The frightening public health toll of CAPS continues to mount. Patients are overwhelming healthcare facilities around the world, including many of the makeshift triage and temporary care facilities. People are avoiding public spaces out of fear of infection and in compliance with public health recommendations. This has had a dramatic effect on the retail and service sectors. Businesses of all kinds are struggling to operate, let alone provide basic services as their workers have fallen sick or refused to come to work. Some companies have allowed telecommuting, but for most businesses and employees, this is not an option. Public health agencies have issued travel advisories, while some countries have banned travel from the worst affected areas. As a result, the travel sector is taking a huge hit. Travel bookings are down 45%, and many flights have been canceled. A ripple effect is racing through the service sector. Governments that rely on travel and tourism as a large part of their economies are being hit particularly hard. Consumer confidence has fallen dramatically, and people are delaying or canceling discretionary purchases. As a result, manufacturers are scaling back production on many goods. On the other hand, staples like food and medicine are being hoarded. Mandated border closures and trade restrictions are creating severe localized shortages. The Purchasing Managers' Index suffered its sharpest decline in 50 years, a leading indicator that markets are preparing for a prolonged period of economic disruption. In some regions, politicians are adding to the noise and confusion through social media. Ban all goods and travel from infected countries, and boycott companies that spread disease are common Twitter refrains often led by public figures. It's safe to say we face a tough dilemma. The movement of people may facilitate the spread of CAPS, but interruptions to travel and trade may have economic consequences that are just as bad.
And to give us more detail on these issues before our discussion, Lucia Mullen.
CAPS is spreading, and it's largely due to the movement of people. Individuals from affected regions traveling to unaffected areas, and susceptible people traveling to affected areas and getting sick. Travel poses real health risks, both of spreading the disease and of travelers getting sick. In fact, many travelers to affected regions have gotten sick, and some have died. Many countries have issued travel advisories for affected parts of South America. Additionally, politicians in a number of countries have called for bans on all travel and imports from affected countries. A few countries have actually banned all inbound travel and some trade from those countries. The total number of reported cases is currently about 30 times the total we saw with SARS, and 100 times the number of MERS cases so far. And disruptions to both local and global travel and trade are commensurately greater. On the other hand, public health experts inform us that travel and trade bans and fever screens are not effective at preventing importation of a highly contagious respiratory illness. Studies suggest that at best, they can delay importation by a few weeks. Some countries have advised against travel to countries in South America. Others are advising against traveling to any country with cases. A few countries have even put bans in place for persons or goods coming from countries with cases. These disruptions are beginning to have major economic consequences for the South American region and will soon have cascading effects globally. We are anticipating far greater disruptions to trade and travel may be on the horizon. One prominent economist estimates that global GDP could fall an additional 4% as a result of travel and trade restrictions. This would cause a severe global recession. Such a severe recession has the potential to result in both high unemployment and runaway inflation, creating the groundwork for national instability and change in the global political landscape.
So the policy crisis for the board to consider in this meeting is this: how should national leaders, businesses, and international organizations balance the risk of worsening disease that would be caused by the continued movement of people around the world against the risks of profound economic consequence of travel and trade bans? So what does this board recommend? And remember, as we're thinking about this, that this pandemic is now already 10 times as large as the 2014 West Africa Ebola outbreak and growing exponentially. So, your views. We've got a big dilemma. People moving.
Welcome back. Please silence your phones. We now pick up this scenario 3 weeks later at the third meeting of the board on November 29th, 2019.
The CAPS pandemic continues to grow, with more than 1 million cases and an estimated 73,000 deaths worldwide. These are only estimates because many countries are having trouble keeping up with surveillance and laboratory testing. Our models are showing that with this continued rate of spread, there may be 5.5 million cases and almost 350,000 deaths in 1 month. The 3-month projection is alarming, with potential for over 30 million cases and 3 million deaths. The Americas are still the most severely affected, but there are large outbreaks occurring in many countries across the globe. Countries with limited healthcare infrastructure have seen the highest death rates so far, but healthcare systems in high-income countries are also becoming overwhelmed. Financial markets have tumbled, with all down significantly for the year. Economic disruptions are being felt across the globe.
Thank you.
The response to the CAPS pandemic is now the most expensive international emergency ever. Political leaders around the globe are faced with many impossible dilemmas, including financial. We have 2 guests today to discuss the bottom line of catastrophic response. First up is economist Dave Gamble. Are we out of money?
The best way to answer that is no, we are not out of money. Yet. But the fact is we are trending in a dangerous direction and something needs to change.
You have been quite vocal about that and generated some controversy along the way.
Well, look, you know me. I try to avoid controversy. But come on, common sense says it shouldn't be controversial to suggest our response should prioritize both lives and livelihoods. Absolutely, we need to save lives. We all know someone who's been affected by CAPS. But we literally cannot afford a heavy-handed response that suffocates our economy. Pragmatism is a wise choice. I mean, what exactly are the risks and benefits of slowing air travel, of staying home from work, closing schools, disrupting supply chains, interfering with our reliable channels of communication and news? Sure, some of these steps can help slow CAPS, but often only marginally and with serious costs. When this is all over, some families, some cities will have suffered more from our interventions than from CAPS.
No question, there is a lot of suffering. Let me welcome Dr. Juan Perez to this discussion. Is Dr. Gamble wrong?
Actually, in a way, we agree. Responders, whether international organizations, governments, or even employers and families, each are weighing risks and benefits. And there is not a one-size-fits-all approach, as there are different appetites for risk. What I will say, in my mind, our response should aim to protect every life we can.
Of course it should be. But let's be frank, letting the global economy slow to a halt puts lives at risk.
Yes, but there does need to be a balance.
Okay, you both agree balance is paramount. Theoretically, that's an easy choice, but leaders are now faced with very real and very tough decisions. Just last week, traditional sources for emergency funding had exceeded their limits. As new mechanisms are being discussed, there is consideration as whether funds should primarily support health emergency response or prop up economies.
Precisely. And we do need these funds sooner rather than later. Funding shortfalls are putting lives at risk and extending this devastating crisis.
Again, we seem to agree. We cannot shortchange the health response, but I suspect we disagree when I suggest that some of these funds are best used to save jobs and critical industries. National leaders certainly have this on top of their minds during the ongoing debates.
Look, I am not an economist or a politician for that matter, but as a physician, I am comfortable saying that our health response to CAPS cannot afford to wait for an incredibly complex debate about what sounds to me like history's most expensive economic bailout.
Thank you both, and we will be watching and listening for the outcome of these vital discussions. And certainly, the market is eagerly watching for any signs of hope.
Okay, to go deeper on this, Dr. Eric Toner from our team is going to give details about the financial situation.
Thank you. The economic impacts are being felt in all countries. In fact, losses are greater in the wealthier countries despite having fewer cases. This chart shows economic projections for global per capita GDP. If trends continue, preliminary modeling from leading economists suggests there could be an 11% decline in GDP at the one-year mark into the pandemic, and a 25% fall in GDP at the two-year point when after the full effects of the pandemic are felt. There is significant uncertainty about how quickly GDP would recover, but economists fear that the pandemic could push the world into a prolonged period of significantly slower growth. Unlike recessions due to normal business cycles and market forces, a recession caused by a severe pandemic would be unprecedented in the modern age because of the huge loss of both workers and customers. The closest parallel may be the Great Depression, but the anticipated global recession due to the CAPS pandemic could be much deeper, and it could take much longer to recover. There are a number of places where financial resources could be helpful in reducing the economic impact, including public health and medical response, helping national economies, and supporting struggling businesses. But there are a lot of needs, and there's not enough money to go around.
Okay, we will now advance 3 weeks to the fourth and final meeting of the Pandemic Emergency Board on December 18th, 2019.
We now have an estimated 4.2 million cases and 240,000 deaths. Almost every country is now reporting cases, and those who aren't may simply not have the resources to conduct surveillance. We're not sure how big this could get, but there's no end in sight. Financial markets are universally down by 15% or more on the year. Fear of a catastrophic pandemic and uncertainty about the capacity for governments to respond and remain viable are fueling investor uncertainty.
We have called this meeting today because of major strategic problems around communication that are happening globally. And here's a media debate that just happened on air today.
Alarming news emerging from social media companies today about the CAPS pandemic. Twitter and Facebook are reporting they've identified and deleted a disturbing number of accounts dedicated to spreading disinformation about the outbreak. For more on this, we go to our correspondent, Catalina Parks.
Chen, these accounts were created by several state-sponsored groups intending to sow political discord, and some individuals are seemingly seeking to gain financial advantages. Violence against healthcare workers and minority populations has been increasing. A recent riot highlights the real danger in these posts. Countries are reacting in different ways as to how best to manage the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
Thank you, Catalina. For more on this, we are joined by experts on crisis communications and social media, Kevin McAleese and Sarah Lee.
To me, it is clear countries need to make strong efforts to manage both mis- and disinformation. We know social media companies are working around the clock to combat these disinformation campaigns. The task of identifying every bad actor is immense. And experts agree that new disinformation campaigns are being generated every day. This is a huge problem that's going to keep us from ending the pandemic and might even lead to the fall of governments, as we saw in the Arab Spring. If the solution means controlling and reducing access to information, I think it's the right choice.
I agree with Kevin. This is a big problem and doesn't even account for the massive amounts of misinformation being generated by legitimate users about the pandemic. But it's not just trolls who are spreading the fake news. It's often political leaders themselves. Who's to judge what's real or not? Would we trust every government to separate truth from lies?
I think this is more than just keeping the bad information out. It's also about making sure real public health information reaches the public. News is found from outlets other than social media. News organisations, public health groups and companies need to help people take the right actions to protect themselves by promoting accurate, real information about the outbreak.
Okay, for more on this, we're going to get a briefing from our communications expert, Dr. Sell.
Global health experts have highlighted that dis and misinformation are wreaking havoc on the CAPS response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines, and have seen public faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. Polls have shown that mis- and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation messages come from a variety of sources, even government officials. And often governments are contradicting one another. We know that social media is now the primary way that many people get their news. So interruptions to these platforms could curb the spread of misinformation, but could also limit access to information from legitimate sources. Health ministries around the world are attempting to combat mis- and disinformation by amplifying public health messaging through social and traditional media. But they are being outpaced by false and misleading information. National governments are considering or have already implemented a range of interventions to combat misinformation. Some governments have taken control of national access to the internet. Others are censoring websites and social media content. And a small number have shut down internet access completely to prevent the spread of misinformation. Penalties have been put in place for spreading harmful falsehoods, including arrests. Other countries have taken a more moderate approach and have focused on promoting fact-checking efforts and working with traditional media outlets, yet these approaches are limited in scope. Social media companies report that they're doing all they can to limit the use of their platforms for nefarious or misleading purposes. But this is a technically difficult problem, and false, misleading, or half-true information is difficult to sort without limiting potentially true messages. The bottom line is that members of the public no longer know who to trust. Both the misinformation and the measures to control it have led to a crisis of confidence.
Thank you, Dr. Sell. So here's the policy crisis for this meeting of the board. How can governments, international businesses, international organizations ensure that reliable information is getting to the public and prevent highly damaging and false information to the extent that's possible about the pandemic from spreading and causing deepening crisis around the world? How much control of information should there be, and by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments?